Now, I've heard of a superfood. That is something that's supposed to be abundant in beneficial macro and micronutrients. Certainly, we've all heard of Superman. It's a guy that goes around real strong, helping people. Some of us have even heard of the movie Super Troopers back in the early 2000s, where the police officers would go around with pride laughing as they arrested people for cannabis possession. Hey, I don't agree with the premise, but it was a funny movie. But have any of us heard of the term super medicine? Now, certainly there's a need for super medications in our society. Many of us are disappointed with our current pharmaceutical options. That is, we could look at their sheer lack of effectiveness, oftentimes coupled with intolerable side effects, and sometimes even the risk of death. And in this video, I'm going to give you my top 5 reasons why I think cannabis is a super medication. Welcome to the planet's premier medical cannabis education channel, unabashedly brought to you by the University of New Mexico's Medical Cannabis Research Fund. Now in this video, I'm going to give you my top 5 reasons why I actually think that cannabis is a super medication. And this has to do with its relative effectiveness, safety, and ease of production. Reason number 1, its relative effectiveness and wide range of therapeutic potential. In one of our very first assessments of the Relief App database, which is the largest of its kind measuring real-time effects of cannabis usage in the United States, we found that patients on average experienced a symptom intensity reduction of between 3 and 5 points on a 10-point scale across a huge range of different types of health conditions. There's 2 points I'd like to make. The first is the sheer magnitude of symptom intensity reductions experienced by patients. That is between 3 and 5 points on a 10-point scale. That's huge, both clinically and statistically. The second point I'd like to make is if you just look at the sheer breadth of different types of health conditions and myriad different types of symptoms that seem to be effectively treated with the usage of cannabis. There's no other medication on this planet that I'm aware of or that you're aware of that offers such a wide therapeutic potential. Point number 2, cannabis is relatively fast-acting. Not only is it disseminated throughout the body in a matter of hours, but a patient can experience its therapeutic effects within minutes. When you contrast that with other types of pharmaceutical medications, such as antidepressants, which can sometimes take weeks or even months to take effect, well, in this case, patients are offered a short-term solution. Reason number 3, cannabis is relatively safe. Now, don't get me wrong. There are many potential negative side effects that cannabis users have reported and experienced. But the point that I keep trying to make is that when compared to those of conventional pharmaceutical medications, which are oftentimes quite severe and adverse and intolerable, sometimes even carrying the risk of death, the side effects experienced by cannabis users are, well, they're relatively minor. Certainly at this point, all of us are familiar with the current epidemic that we're experiencing, where people are overdosing oftentimes on prescription medications. There are many different classes of pharmaceutical medications that are contributing to these daily death tolls. Cannabis is not one of them. The 4th reason why I do believe that medical cannabis is a super medication stems in its preventative functions. That is, after thousands of years of humans consuming cannabis, there's still a dearth of substantiated recorded information that could even suggest that long-term cannabis use causes physiological damage to the body. In contrast, there's emerging research all around me that is suggesting that cannabis is an effective preventative force, particularly for diseases that have to do with inflammation, neurodegeneration, and other types of common ailments like diabetes. The 5th reason why I do believe that medical cannabis is a super medication stems from its ease of production. That is, just about anybody could get a little seed, stick it in the ground, rely on God-given resources of sunlight and water to ultimately and independently be able to produce what just may be a miracle medication. Now, this is in stark contrast to our conditioned belief that all of our healthcare needs to come in the form of a little plastic pill manufactured by a real fancy building somewhere far away. And as a bonus reason why I do believe that medical cannabis is a super medication, and in addition to any potential disease remedying mechanism that it offers, I also believe that it induces alterations in our perceptions. That is, how we tend to think about ourselves and the way that we think about other people, in ways that I do believe will benefit society. In fact, we're conducting a study right now to measure how different levels of cannabis exposure affect normative psychological functioning in otherwise healthy young adults. Of course, once we get the results, you're going to be the first to know about them. As always, please consider hitting the like and subscribe button, sharing our videos, becoming a patron for this channel, and also please consider donating to the Medical Cannabis Research Fund, where we are conducting cutting-edge, pioneering research and advocating every single day for your God-given right to be able to make sound, objective medical decisions. Together, we are changing the world.